Hey, Margie here. Today we're going to talk about a really important topic, and that's breast cancer. And we're going to look at it through a lens of empowerment. What can be done while we're going through treatment and afterwards to prevent reoccurrence, as well as what can we do so that we keep our bones strong and healthy, even if we're on medication and after chemo. And our very special guest today is Dr. Carole Lourie. And Dr. Lourie is a dedicated practitioner with over 3 decades of clinical experience as a naturopath, acupuncturist, and homeopath. And she's helped hundreds of women recover their health and restore their life through her holistic protocols, focusing on nutrition, targeted supplementation, lifestyle changes, and a centered mindset. And Carole specializes in complex and chronic disease management, focusing on women's health, specifically breast cancer, fertility for older women, and autoimmune illnesses. And when the body and mind work together, healing is always possible. But today we're focusing on breast cancer. As I said earlier, what can be done to keep our bones and overall health, keep ourselves healthy while we're going through treatment, and what can we do to prevent reoccurrence? This interview is filled with really wonderful tips, so stay tuned. Welcome, Dr. Lourie. I'm really so happy to have you here on the podcast because this is a topic that's needed and not everybody knows about all the things that are available. So thank you so much for being here.
I'm so happy. Thank you for having me. I can't wait to share all this important information with your audience.
So let's just start, before we even get started, tell us your backstory, why you're so interested in breast cancer, prevention, as well as helping people afterwards. Why don't you just share your story so people will understand why you're so passionate about this topic?
I'd love to. So I am a naturopath, an acupuncturist, and a homeopath. And I have a very busy practice in Berkeley, California. And I did a lot of women's health. But for me, breast cancer was just a disease that I knew about a little bit, but it hadn't impacted me personally until one morning, the phone rings in my home. And I think it's initially like a fake phone call. And then I realized it was my dear friend who was hysterically crying. And I said, "What's the matter?" And she said, "I have breast cancer. They found a lump." So at that moment, it became very personal to me. And I said to her, "I am going to go through every aspect of treatment with you," which ended up being 18 months. It's a very arduous journey, and you don't understand how difficult it is until you do it, either as the person who is ill or as a caretaker. But going through this 18 months of treatment, biopsy, chemotherapy, radiation, surgery, and then she had to have her uterus taken out because she had an adverse effect to tamoxifen, which is more common than people think. And during the treatment, when we would go home, I would take care of her. So I got to see up close and personal what was working within the medical profession and what was lacking. And that's where I began to use my skills as an integrative practitioner and really ramped up my knowledge about breast cancer from an integrative perspective as well as the medical perspective. And I was wondering, is it working? Is it not? So one day we were in the oncology office at UCSF, and the oncologist looked up at her blood work and looked at us and said, "I don't know what you're doing, but I want all of my patients to do that too." She said, "You don't even look like you're in the middle of chemotherapy. You have no anemia, your white count is great." And my friend felt good and she had a very positive outlook. And that was the beginning of me focusing my clinical practice and bringing my online community into the world of integrative tools for breast cancer.
Wow. And how long ago was that?
Well, that was 15 years ago.
Wow. Isn't that
She's been
incredible?
cancer-free for 15 years. And since then, I've helped hundreds, if not thousands of women all over the world, which is the beauty of what we do with our online community. I have had women from Sweden and France and Malta, of all places, this beautiful little island. So you can reach people all over the world. And I am committed to getting this important information out to as many women who need it.
And it's so empowering that it's not like, just waiting for a shoe to fall, just waiting for something to happen, but you are giving people tools that they can put into their life that that are actually good for everybody, but especially those who want to prevent reoccurrence and just stay as absolutely healthy as they can. And I think what's interesting is that sometimes when you do these, you feel better than you did beforehand. Do you find that with people that
Well, that's my goal. That's
Yeah.
my goal, because breast cancer, it's not just a one thing disease. And when I'm on a lot of Facebook pages and groups, people say, oh, you have to take this, you have to take that. And it's not one thing. That's part of my messaging. We need to create a comprehensive protocol, which involves my 6 steps. But basically, cancer is a metabolic disease. So I love that you said the word empowering, because you have a lot of empowerment and much more control over whether you get a recurrence or not. And the statistics for recurrence are pretty formidable. Up to 13% of women, it used to be 7 to 11. Now it's up to 13% of women will get a recurrence in the first 5 years post treatment. But there is a lot you can do to change that statistics. You can change how you eat, because cancer is a metabolic disease. And when you change how you eat, that reduces the amount of gas for the cancer gas tank, so to speak. You can take certain supplements, which will cut off the cancer's ability to spread and divide and bring its neighbors into, like, hey, let's make more cancer. You can change the tumor microenvironment by taking supplements. You can develop a healthy lifestyle and detoxify your home. You'd be surprised how many women have chemicals in their home that are contributing to cancer. So there is a huge amount that you can do to reduce your risk of recurrence. And we cover all of that in my online program. And I also have an online program for women who are in the middle of treatment, because there is a lot you can do to reduce your side effects from chemotherapy and radiation.
Let's go into that, because bone health really suffers. And I see this all the time. I have so many women, all ages, who have just finished chemo and their bone density is reduced for several reasons. And they're now on medication that additionally reduces bone, it can also reduce bone health and bone density. So why don't you fill us in on that whole scenario and what you recommend?
So bone health is like every other aspect of our metabolic well-being. There's not just one thing that we need to do to take care of our bones, as you know, but chemotherapy and radiation do impact the health of the bones. And what very often when a woman is finished what I call active treatment, she gets a bone density scan. And basically, I feel that's just part of the pathway they put you on, because most women who are older have almost reached the level of osteopenia, because in our cultures, we're all sitting too often. There's not enough calcium generating foods in our diet. Now, I don't think that means we all need to be eating dairy. That's a misnomer. Let's just say that. That's, the advertising dairy industry who spends billions of dollars making us think we need to eat cow's milk and cheese for our bone health. That's not exactly true. Bone health, as you know, and you work with your community, it's a complex interplay of nutrients and dense exercise and all of that. But post chemotherapy, you're at risk because, one, you've reduced your nutrients that you have taken in through your diet. And we need to boost those nutrients back up, such as with leafy greens and our potassium levels and certain calcium generating foods. And we also need to make sure that your environment in your body is basic as opposed to acidic, because acid generates cancer, generates inflammation, they feed into each other. So I have women check their pH of their urine in the morning. It's very easy to do. And we want to, as you change what you eat and you take certain supplements and you drink your smoothie and maybe your Beeler's broth, your urine becomes more basic. And that is one of the other methods that we do. And then there are very specific supplements, which I recommend women take. And I think that, the supplements with the bone jarring exercise is very important, or bone jarring movement, I should say, is very important for bone health.
Do you want to share what supplements? I know there's a whole array, but the key ones that you have found for people?
Boron is very important. K2 is very important. A certain form of calcium is extremely important because so many women come in with calcium citrate or calcium from bones from oyster shells. And that's for like a 25-year-old. That's not for a woman who is wanting to prevent osteoporosis. And I have certain companies that make really very specific supplements for to prevent osteoporosis for positive bone health.
Okay, so yeah, the food is so very important. Do you have the people that you work with who are going through chemo? Do you also, do you start this at that point if they can tolerate it?
Well, they're on, going through chemo, we use intermittent fasting prior to the actual infusion. They are on a healing smoothie and they are on supplements, and we stop the supplements. This is the thing that, this is the secret that nobody knows about.
Okay.
Because oncologists will say we're having a secret moment. Too often oncologists say absolutely no supplements. And actually there's a great deal of research in PubMed which shows the benefit of certain supplements. For example, ashwagandha potentiates chemotherapy. This has been scientifically proven in PubMed. So you want to use supplements to your benefit. And that's what I was doing with my friend who did so well during chemo. But here's the secret. You stop them 2 or 3 days before your infusion because you want to respect chemotherapy. You want it to do its job. You prepare for chemotherapy. You can't eat a steak tonight and go to chemotherapy tomorrow and think you're not going to be sick. So using intermittent fasting before chemotherapy infusion, what that does for your body is the healthy cells go into protective mode because they shut down to protect the glucose that they have. But the cancer cells go, oh my God, I'm starving. Where's the glucose? And when the chemotherapy comes in, they think it's food and they grab up that chemotherapy more than the healthy cells, which have a wall around them. So you're getting the benefit of chemotherapy and you're protecting your healthy cells with intermittent fasting. And you've stopped taking your supplements 2 or 3 days before, and you stop taking them for 2 or 3 days afterwards. So you are not interfering with, getting your infusion in a positive way. But then you have all the time in between, which is like 2.5 weeks of getting the benefits of these supplements, which will help you maintain your bone health and maintain your health of your intestines and your brain biochemistry. I mean, there's a lot that we can do.
Wow, it sounds like the right mix, that you're getting the best of both worlds. I love that.
That's my attitude.
Yeah, and it's not as though this hasn't been shown. I mean, there's research studies on intermittent fasting. Do you find that now in most big centers that they are doing this type of protocol?
I wish. That's my goal. It's my goal. I mean, intermittent fasting is well documented, but unfortunately, I have yet to come across a major oncology center that employs that if only they would. I mean, I'm interested in doing studies about the benefits of that, and it's not that hard. I mean, what happens with intermittent fasting, women go, oh, I can't go without food, I'll get hungry. So you eat an early dinner. Let's say you finish eating at 5 p.m. and you don't snack at night. That night snacking is the worst for all of us. We should not be doing that. That's called how to put adipose on your body without even trying. So you have an early dinner at 5 p.m. And then let's say 5 p.m. to 7 a.m. is already 7 and 5. It's already 14 hours. So the benefits of intermittent fasting have been shown, very clear research, to occur between hour 13 to hour 16. So if you just show up at chemotherapy with your, healing teas, and I provide women with those recipes, and maybe your Beeler's broth, and maybe you bring a smoothie with you, so that you fasted for 14 to 16 hours, and then you go into chemotherapy and you have your drinks to drink, then you're going to be in great shape. Because I remember the first time I went with my friend to an infusion center at UCSF, as soon as we show up, they said to her, well, you look a little thin. Would you like some Ensure? The number one ingredient of Ensure is glucose. And then a few hours, and then like half hour later, would you like a popsicle? Would you like a hard candy? And then when she finished, they offered her a cupcake. So I was a little alarmed, to put it mildly. Here we are getting chemotherapy and we are being offered sugar. Now, for those of you who don't know about sugar and cancer, in 1918, there was a wonderful German scientist by the name of Otto Warburg, and he won the Nobel Medicine Peace Prize for this discovery. He discovered, and this was in 1918, that given a choice between glucose for energy and oxygen, cancer cells will choose sugar or glucose, even though they get much less energy or ATP, and even though it's a much more difficult pathway to get there. That's called aerobic glycolysis. So that was the beginning of adopting the attitude that cancer is a metabolic disease. You are empowered in how you feed cancer cells in your body by reducing the amount of sugar and carbohydrates that you intake. And this is true not just for breast cancer, but for all cancers across the board.
And it's so interesting. Unfortunately, my mother passed away. It was a long time ago, and from ovarian cancers. But I spent many years in chemo, and exactly what you said. Just and basically, oh, give her anything. It didn't matter. This was
Yellow,
before. This was
right?
before I was a health coach. Just get food in. You can give her McDonald's. I mean, anything.
Ice cream, milkshakes. Yes.
Right. Just get the calories in. That was sort of the attitude. And it's sad to me that hasn't really changed so much some places, but
some places.
Yeah. I know in the integrative cancer centers, I know they're adopting lifestyle and supplements. And I think that's exciting. And I think that's why the work you do is so important. But the good news is that it makes a difference. And I know that I was reading some of your information that people have less side effects as well.
Absolutely. When you prepare for chemotherapy, you don't get as nauseous. Your blood work is better. You can protect the health of your stomach and your gut lining, and you can protect your bone health, and you have more energy, so you can go outside and do a little bit of walking. Like even 10 minutes out and 10 minutes back can make a big difference. You can lift your 1 pound weights for 5 minutes twice a day. I mean, that movement is very important, because when you move, you're keeping the energy of your body flowing smoothly, and it reduces risk of blood clots.
Wow. And with the bones, if you don't use it, you lose it. So one way, if people are feeling better that's going to make a huge difference in the bone loss. Wow.
Even if you sit in your chair and you lift your weights, and then you lift your legs. I mean, if you do that, if you don't have enough energy to walk outside, or it's raining or snowing, there are lots of online. The beauty of online is you can find lots of exercising that you can do in your home.
I think the important thing is to be aware, because a lot of people just want to get through it, and they're like, just let me get through this and I'll deal with it after. But I think they don't realize that if they just do a few things, and especially when they're feeling good, it's going to make afterwards so much different, and where they're starting from. So I love that your program has all of this in it.
There's 3 phases of breast cancer. There's the treatment phase, there's the recovery phase, and there's the preventing recurrence. And that's my umbrella program, The Path of Breast Cancer. You can find it online, thepathofbreastcancer.com. It has those 3 phases in there, and you can buy all 3 of them, or you can just buy one. But that's the online component of my educational program. And each phase has 5 chapters, and each chapter is filled with meditations and functional information. And it's different for treatment, because in treatment, all of a sudden your life as you knew it, and as a woman, we're all busy. And when you think about all the little tasks that we multi-do every day, we need to bring in our community and friends and family to take over for you as much as possible, because you are going to be incapacitated for a while. And so as part of the treatment modality, we have an Excel sheet, how to get your community to sign up for all the little tasks that you do, and how to find somebody to take that over for you, because you don't want to be spending your time on the phone or on email coordinating all of that. And then in recovery, it's how to make time to do certain things for yourself that we usually take care of everyone else first. And then in the Empowered Against Recurrence program, I really employ the 6 steps with live group coaching with me for 6 weeks in a row. We go through nutrition and supplements and mindset and healthy lifestyle and putting it all together. And then we also have, for that bonus week, we have reducing the side effects of tamoxifen and aromatase inhibitors. Because as you know, Margie, because you're a bone expert, that one of the main side effects of those medications, which also are beneficial, they create osteoporosis.
So maybe share, I know your program goes in real detail, but is there anything you can share with the audience? Because there are people who have had cancer a while ago and they've been okay. And I find different philosophies. Oh, I'm fine. I don't need to worry about that. Or, I want to keep doing everything I can possibly do. But a lot of these people are on this for life, for extended periods of time. And so if you could share, are there any easy things people can do who are on these drugs?
Well, I want to share that in my last group, I had a woman from Seattle who had cancer 20 years ago, and she was told that she was, quote, cured, but she didn't want to take that risk. And she said to the Seattle Cancer Center, isn't there anything else I can be doing? And they said, no, you're done. And she came to my program and went through the 6 weeks. And what she realized is, one, she had to massively reduce the amount of sugar that had snuck into her diet, not just white sugar, but simple carbohydrates like white potatoes. People don't really think about that. And, even if it's gluten-free bread, it's still a carbohydrate, which is easily processed. And often the gluten-free bread is white. It's made with brown rice flour, and that tends to be very high glycemic index. So there's certain things that we need to understand about sugar. It's not just the white sugar, which nobody should be eating, or over-the-counter pastries from a supermarket, which are so not okay. It's about, even if you think you're eating healthy, where are you getting, how is your carbohydrate count? So an easy thing that we do is I have people download an app, which you can easily find, and count your carbs meticulously for a week. And people are shocked. So that's number one. The number two is, how do you start your day? Because the first thing that we eat in our body provides what I call the metabolic messaging that our body receives for the day. So if we start the day out with coffee with sugar in it, already you're like giving your body the message, the cells, okay, here comes a lot of sugar for your energy. Now, I'm not saying coffee is bad and you should stop drinking it, but maybe you want to start your day out with some tinctures that I recommend, or a couple cups of green tea, which also has caffeine in it, and then eat a little bit of protein for breakfast, and then have your coffee like at 10:30 or 11 o'clock. That's a different experience for your body. And I'm also a big proponent of not snacking at night, because that is called how to get those love handles on you. I mean, one of the things that happens with aromatase inhibitors and tamoxifen is your body all of a sudden, I have it in my program, it's called the +5 to 15 pound syndrome. You've closed your eyes, you wake up, you're 5 pounds heavier, at least. I've had women gain 30 pounds. Wow. And because the body wants to hold on to fat, because fat has extra estrogen in it. So we have to really look at, first of all, how are we eating? Maybe our portion sizes need to be smaller, and we definitely have to up how much we move. And that can make a really big difference in that +5 to 15 or more pound syndrome, which occurs without even thinking about it when you're on these medications.
Wow, those are great tips, because certainly nobody wants to increase their weight with, and also
well, some women, do need to put on a few
true.
pounds.
Yeah.
But I mean, for those of us who are like a normal weight, gaining, I'm short. If I gain 6 pounds, it's not healthy. I can feel it. It's not healthy for me, not to mention none of my clothes will fit. But, and it's not like I think everybody needs to be slim. I don't want that, people calling me about that. It's about when you have breast cancer or any other type of cancer, the less adipose we have on our body, the less we have feeding potentially the cancer pathways. And that's what we want to be aware of.
Oh, great, great tips. And it's interesting. What I've been seeing is very young women. I mean, just recently, someone I know had ovarian cancer. It wasn't breast cancer, but I was on chemo.
It's very similar. Yeah.
On chemo, 26 years old, on chemo. And now they want to put her on osteoporosis medication at 26. And a lot of times they do that. You come off the chemo and they immediately, or even while you're on the chemo, before you've even lost bone. So what have you seen with alternatives to that?
Well, every case is, every person's individual. A 26-year-old on osteoporosis medication is too young. And, the medications have their positive, but they also have their side effects. And one of the side effects of certain osteoporosis medications, bisphosphates, is that the longer you're on them, the greater the risk of long bone fractures. And I've had women in my practice who have just been standing there and their femur broke. It's very painful and scary. So I think that woman, the 26-year-old, and, there are groups of, in the Bay Area Young Survivors Coalition, there are young people with breast cancer all over the US, and there's Facebook groups with these people. And I'm always on there recommending, let's put you on somebody like your program. Let's make sure you're on the right anti-osteoporosis supplements. Let's make sure your diet is not filled with dairy, because that's a misnomer, that you're getting bone jarring exercise, which is really critical. I mean, it's, as I always say, it's not just one thing, it's a whole program. And the problem with the messaging of these drugs, unfortunately, is take this and you don't have to do anything different. You don't have to change your lifestyle. And my messaging is, yes, we have to all adopt a healthier lifestyle when you have a serious chronic illness, such as an autoimmune disease or any type of cancer. We have to, if we want to be healthy and have our optimal life, change how we live.
And I couldn't agree with you more, because people think it's a quick fix. People think, okay, I'm on the medication. So I'm on the tamoxifen or whatever I'm on to prevent the breast cancer. And now I'll take something else so it doesn't affect my bones. I'm done. So
Right.
Exactly what you said. But the good news, and I see this time and time again, and I know you see this is the experience you're explaining to me, is that when people do adopt this healthier lifestyle, just everything falls in place. And even I teach happiness, so even people's mental state changes. So it's something can be a blessing in disguise in a strange way. So I love
it's a
that.
bit of a catch-22. If you don't feel well, you develop what I call the couch potato syndrome. And you just sit there, and I talk about this in my free class that I offer. And I give an example of a woman I work with. Her name is Anita. She didn't feel well. And I also had a woman in my practice. Her name was Ellen. She didn't feel well. She came to see me 10 years after she'd been diagnosed and had developed the couch potato syndrome. And it took a while. I mean, we just started, there's a lot of changes. You can't do them all at once. So we started with reducing her sugar and carbs in her diet. And then we added the healing smoothie, and then we added a few supplements. And then about a month and a half later, she said, well, I'm feeling better. I think I can start using the treadmill, which is in my garage, which I haven't been on in 10 years. I said, great. How many minutes do you want to start out? And she said, a half hour. I said, no, we're doing 5 minutes at the beginning. 5 minutes every day for a week. And after 5 minutes, and then she began to really feel like, oh my God, I can feel it in my body. I'm getting back in my body. So week number 2, it was 10 minutes. And week number 3, it was 15. And then at the end of the month, she was up to 20 minutes. So that was, and as you said, it's self-fulfilling. When you start doing it, you start feeling better, but you have to start literally. I'm a big favor of the 5-minute start, because what happens with us is we go out and we think that we can start where we used to be when we were healthier. And then we get really upset and depressed that, oh my God, I'm in such bad shape, I'm just going to give up. So, and that started, when I started exercising outside after this lockdown we had, I started with the 5 minutes out and the 5 minute back, because I live in a hilly neighborhood. And I could have said, oh, I'm like horribly out of shape, I lost all my muscle tone, I'm going to give up. But I just kept up with the 5 minutes. And now I'm up to 1.5 to 2 miles 5 times a week. And it took, 8 months to get there. But that time goes by anyway. So we might as well be doing something that's going to eventually make us feel better. But we have to start slowly. And our society doesn't have any support for the start slowly approach. You see these people in the gym and they're lifting their 25-pound weights and they look fantastic. You don't know what they went through to get there. You don't know that that took 2 years, right? And it really doesn't matter for them. We can't compare ourselves because we're each our own little being.
To me, the worst thing is overwhelm. I think that's the enemy. That's the enemy of happiness. That's the enemy of really getting anything done. So I love the 5-minute rule because that's doable. And if you take small steps, you get to reach your goal, and it works, and they're sustainable. And that's what I found is the only way to do anything, because otherwise it's overwhelming and people stop and they don't follow through and they're unhappy. They're like,
Right.
they can't stand the program. So instead of being something that's supportive and nurturing, it's feeding the wrong messages to you and your body. So it's just, but that's, now I have a question for you. So people who are listening maybe had cancer 20 years ago and they've been okay. Is it ever too late to start implementing the things that you're teaching?
Well, that's just like this woman from Seattle who just finished my last program. She was the person who'd had cancer 20 years ago, and they told her she was fine. And she said, no, I don't believe that. I want to do. So no, if you've had cancer 20 years ago and you're fine, thank goodness. But it doesn't ever hurt to come in and join the group and let's see what else there is out there. Maybe I need to adjust my supplements. I mean, that's a very big thing. I mean, one of the things I do offer is a 1 hour of my time for a very reduced fee in which we look through your supplements, and you'd be surprised how much money that saves you. Because people come in, they've done Dr. Google research, and then they don't know what supplements are made to pharmaceutical quality standards. The worst is when people have supplements from Trader Joe's or Costco or CVS. I mean, I am a supplement snob, and I've done a lot of research to make sure what I recommend to people are from companies that make their products to pharmaceutical quality standards, which means every single item in that product has been third-party tested, and there's a line that you can follow where it was bought, when it was third-party tested, and there's efficacy in all of the products. So that's very important.
I think you really brought up an important point, because we can only handle so many toxins in our system. And I know that's something that's part of your program, but when you have all the chemo, it's not okay, because isn't that, we need to detoxify and we need to really reduce toxins all over. You want to just touch on that for a minute? Because I don't think people realize that it doesn't just leave your body.
Well, I don't want to, put chemotherapy into a bad frame of mind,
No,
because I think it's, if you have aggressive cancer, there's a lot of research that proves that certain types of chemotherapy really is beneficial.
Wait, let me just say, I'm a huge believer in chemotherapy. That's not my question. I'm saying after the chemotherapy,
right?
In terms of what you're putting in your body and what, that's more
right.
where I'm
so
talking
chemotherapy and radiation, it's not a free ride. They have side effects. It's well documented that side effects of chemotherapy, one of the main one is that your gut is horribly disrupted, and it does impact the health of your bone marrow. So you can be anemic. Often you're anemic, and it impacts your white blood cells. So there's a lot that we can do with that. So that's, we have the healing smoothie, we have the bone broth, we have the Beeler's broth, we have certain targeted microbiome supplements that we use. And we have, acupuncture and the biomat and chemo and radiation protection with ionatocotrienols, which we don't want to use. That's a very specific form of vitamin E, which you don't want to take during radiation, but you can take. I recommend we wait 6 to 8 weeks after radiation is over. There's a lot of research that show how that is very impactful for reducing the oxidative stress that radiation creates. But during radiation, I have women drink miso soup, which is very safe and fine, will not interfere. You drink a cup before you go in and you drink a cup when you go out. And then we have very specific vegetable juices, which I have women do, which are safe and don't interfere with radiation. But you don't want to take antioxidants when you're doing radiation. We need to protect your gut health, protect your bone health, and do a few things that can really reduce the side effects of radiation.
That's great. And I guess what I meant in terms of the toxins is afterwards, just like you're saying, you don't want to take supplements that are full of additives and different
Oh,
things.
right.
So that's sort of what I meant. We want to really reduce the toxic load we're adding to our body. And I
I did
think
a
that,
s-
yeah.
I did a supplement review for someone and she had a curcumin product which had sugar in it. I'm not kidding. And I'm thinking, oh my God. No, just FYI, everyone, no supplements should ever have any sugar in them. Okay. Curcumin needs black pepper actually to become activated. That's been well proven. So the products that I use do have black pepper in them. That's the turmeric, but no sugar in any of your supplements. And I was alarmed. I mean, we threw that one out, of course, right away.
No, it's because a lot of times, the doctors, meaning well, there are some integrative protocols that are wonderful and they just say the amount. So it doesn't say where to get it from. So I think that was great that you brought up that it really does matter. Not everything is created equal, and there's, some of them have all sorts of additives and some of them don't. And I think that's great that you really research which ones are most beneficial and healthy. Wow. Well, it's just so great that you're doing this work and helping people the way that you do, and knowing that there's help and there's a community, and so that people can thrive afterwards as well. And tell us, I'm excited about your program that's starting relatively soon. Do you want to share what that's
Sure.
about? Because that's something that everybody can have access to, even the
Absolutely.
webinar. So why don't you share what's possible here?
So, several times between now and the end of October, I will be doing a free class. I offer them twice, once in the evening time and once in the morning time, depending on when you work. And Margie will post exactly the times and the links that you can sign up. It's a free class, and I go over a lot of what you've heard, but in much more detail. I go into what are my 6 steps, and I provide some examples of them. And I talk about my wonderful woman, Anita, who I work with, who she had diabetes, and we were able to help her. And because she was borderline, but going through treatment really brought it on, which happens. And then I talk about my 6 steps and how we have the 6 weeks together and we come together as a community. And I've had women say to me, well, I can't, whatever you're doing, I'm too busy. So here's the deal. 2 things. Cancer is, as a homeopath, cancer is one of the illnesses that has energy to it. And that's known in homeopathic philosophy as the word miasm. And when the breast cancer miasm, and there is a remedy made out of breast cancer tissue called carcinosin, the breast cancer miasm has to do with this rush, do. I have to do this, I have to do that, I have to take care of everyone else, I'm not taking care of myself. And you get into the state where you just can't stop. And that mimics the energy of the breast cancer cells, because cancer cells are cells which have decided to stop paying attention to the rules. When we get in our car and we see a stop sign or a red light, we know that we need to stop. Cancer cells have gone, I'm not going to stop at that stop sign. I'm not going to stop at that red light. And not only am I not going to stop, I'm going to get all the neighbors to stop stopping too. So before you know it, all of your cells have decided to stop paying attention to the rules of stop and go, and your immune system is depleted, and they're not able to keep up with these aberrant, unhealthy cells. And that's how that's a little bit of how cancer starts. So when we do something to cognitively say, no, I am going to take care of myself, and you find time to join the community and show up, it lasts an hour, and you're part of the community, you get a lot out of it. However, all the sessions are recorded. All the slides are in part of your online educational program, which you also get when you join the Empowered Against Recurrence program. And the value of that educational program is $197, and the whole cost of the 6 weeks together is $197. So you're sort of like getting everything for free. And then there's lots of bonuses and guest speakers. And anyway, everyone gets a half-hour consultation with me as being part of the program. So there's, and this is all, you'll get all this information when you go to Margie's link for this. But um, just deciding that you're going to give yourself an hour a week to take care of yourself is the first step in reclaiming your health and saying no to that rush, rush, rush syndrome, which so many women feel when they have breast cancer.
Wow. This sounds amazing. And I agree with you. That rush, rush, rush people feel regardless if they have breast cancer or not.
Right.
And, there's, once you change your mindset, it's amazing how much extra time all of a sudden you have. Do you find that as well? Once people say, I'm going to dedicate this, and then I find when you don't, crazy things pop up that take up your time versus when you say, you know what, I'm going to give that hour to myself. So
Well,
I
there's
love
two
that.
parts
Yeah.
of that.
Yeah.
Yeah, there's two parts of that. One is, like you just said, we really decide to give ourselves the time. But the other part of that is stop taking care of everyone else. Because part of the other component of the breast cancer miasm, and I talk about this with Anita, is she had blurry boundaries. She was codependent and taking care of her friends and her family and not taking care of herself. And when you go on an airplane and they say to you, if we need it, put the oxygen on yourself before somebody else, your child. I always used to think that's not, I'm going to put the oxygen on my kid first. If I don't have oxygen on me, I'm not going to be able to put oxygen on her. And here's a little secret. When you stop saying yes to everybody's request to help you, to help them, and they get like a little pissy or angry with you, that is a big clue that those people are not really your friends. And how many of your friends that you're taking care of, do they ever say to you, what can I help you with? I've had women like that was a wake up question for them, and they realized they were on the giving side 98% of the time, and they worked on changing their life. And that's part of what you need to do to recover from an illness, whether it's autoimmune or cancer or colitis or insomnia or anxiety or depression. It's very similar.
Yeah, absolutely. These things are just as important as the food you eat, the exercise you do, for everything. In terms of bone health as well. Wow. Well, this program sounds so incredible. And I love the fact that there's a support group, because it's hard to do things on your own. And you may say to yourself, yes, I'm going to do, okay, Carole talked about this, I'm going to do that. But it's very hard. It's and I think the fact that you have everything step by step and a supportive community to help share, and people who are going through similar things is just wonderful that you've created this. So I can't thank you enough for sharing this with all of us and for giving us the opportunity to become involved in it for those people who this resonates with and feel it can really change their life. So is there any last minute things before we end? But this has been wonderful.
Well, thank you so much for your kind words. The scope of breast cancer is not going away. Everyone knows someone who's been impacted by this illness, and there absolutely is another side to treatment. And my approach is we want to take the best of both worlds, what medical oncology has to offer and what natural and integrative care has to offer. And that way, you're doing everything to get through treatment healthy, and then to recover your health, and then to move on to reduce your risk of recurrence. Recurrence is not just a haphazard thing. It's not like a shot in the dark. There are really things that you can do to reduce your risk. I'm not saying it's a foolproof. If anybody says, oh, you do this and it will never happen to you, it's not like that. But you can absolutely impact your risk of recurrence. And I'm here to share all this information with you.
And thank you so much, because I truly believe that when people do this, other things improve as well. So, and I've had so many people who look back and say that, not that was the best thing that ever happened, but because of that step, so many positive things happen, and their life's very different now and in a positive way. So wow, thank you so much, Carole, for sharing all this. And I'll have all the links for everybody in the show notes. And
thank you for having me. It's been great to be here with you all.
Oh, my pleasure. Thank you. I hope you've enjoyed my interview with Dr. Lourie and now have an understanding of how we can combine the best of conventional medicine plus integrative medicine when it comes to breast cancer and preventing reoccurrence, as well as going through the treatment, and what can be done to protect our bones and keep them strong and healthy. So all the links that Dr. Lourie talked about will be in the show notes, as well as her free webinars that are coming up soon. So thanks so much for tuning in today, and I look forward to seeing you on the next episode.